So when you go to a Native community, the first thing to do is to simply say, this is my first time, and I'm not sure how to act. I'm going to do the best I can, but I need you to help guide me, please. Any mistakes I make, tell me, because I truly don't mean to offend. And if you have worked in other Native communities, remember, there is no one way. One thing that non-Native people have trouble with in our communities is the length of time in speaking. Native people are slow. They take time to think because words have great power. And it tends to take a long way around to explain something rather than just short and to the point.
Food, okay? It has meaning in every culture and every family. It may be slightly different, but we need to be attuned to it. For some cultures, to invite people to come to a meeting and not feed them is the height of rudeness. And so then we wonder about, well, why didn't they come back to the second meeting to plan this? We need to know that.
The food is very important. It is seen as a gift, and it's always given and provided. It's a sign of respect. Also, if you have visiting dignitaries or elders or other people who have come to this, it is very common to give a small gift. It can be something as simple as some ink pens with the name of your organization on it, some notepads, but you would give these gifts. And they, in turn, 9 times out of 10 will have something to give you. The system of reciprocity is the strongest commitment across tribal nations.
Also, food has a lot of cultural and religious issues related to it. So we need to be attuned to that. We don't want to serve food that's going to be offensive to people. We don't want to invite somebody who's having a fast day in their religion and invite them to a luncheon. So we need to be attuned to the food issues and the meaning and culture. And then dates and times. We have to find out from the community we want to connect with. If we're planning to do an event with them or training or have something on television, is it a religious holiday? Is it a special day for that culture? Is it not an auspicious time to be doing a new endeavor? We really have to talk about that time again. It's always that issue of partnering with the community, that we can't sit in our offices and do culturally and linguistically competent health promotion training. We have to be working always in concert with the communities that we want to reach. Now, in the training itself, we always want to think about how culture relates to the topic. And hopefully all the information that we've gathered as we've gotten to know the community about their beliefs, about whether they see the threat, whether they see the perceived benefit, whether they see barriers, etc., that we're using all of that to shape the content. One size does not fit all.
Again, there's no one answer and no one segment. You have to be able to take your materials and your approaches and tailor it to the population that's working with them. There is no one answer in any culture. There's not even one answer in a family. I can tell you now that what my mother taught me about having babies and raising them and what my grandmother taught me about having them and raising them was different than what my nursing degree and my medical background taught me. And I had to combine all three to raise my children.
And just because we did a training last week for this group and that was what we did, when we go next week to this group, we've got to really think again of what cultural issues might relate. When we use case studies, scenarios, and vignettes, we want to make sure they reflect the diverse cultural perspectives that are appropriate to the audience. And we want to make sure that the graphics and pictures on handouts and visual aids reflect culturally and ethnically diverse groups appropriate for the audience. We want them to be respectful. So again, even if we're doing handouts, if we're doing PowerPoints, whatever we're doing, we really want to think about that. We want to use language and literacy levels appropriate for the audience. The Institute of Medicine has just come out with its report about our communication as health professionals, and we're not doing a great job. We have our own language, our own culture, our own jargon, our own ways of seeing things, and we're not being very effective in communicating to the people we really need to get the information to. So we have to get feedback about that and understand it and work it at an appropriate level. Doesn't mean that we have to dumb down the information, because everybody needs all the information. It's how we're presenting that has to be understandable. It's that linguistic competence issue that Tawara talked about earlier. And when we use statistics and data, we want to include information about racially, ethnically, and linguistically diverse groups when it's appropriate. We want communities to be able to see themselves in the data. So we've really talked today, we've gone all the way from understanding this concept of cultural competence, cultural and linguistic competence, the framework for it, how it relates to the work we do. And we've talked some about really infusing that at the steps along the way as we conceptualize our health promotion training. So we hope that this will get you going on your way. We can't give you the magic. We can't tell you this is exactly what to do, because as we've talked about over and over again, what this really is about is developing important, trusting relationships with the communities you want to reach so you can really understand what they believe and what will help them make the behavioral changes that we hope will come about as a result of our health promotion. The National Center for Cultural Competence has many publications and tools available to help you with this work. And you can go to our website, which is listed now on the screen. It's http:// with the little slashes, gucchd.georgetown.edu. And all of our publications are available online. Many of them are available in Spanish. And we hope that that will be a helpful way to help you continue your own journey towards cultural and linguistic competence in health promotion training. Thank you.